What's going on, guys? It's Nathan Humphrey. Today we'll be talking about Progeria, or also known as Hutchinson-Gilford Progeria syndrome. This is an extremely rare progressive genetic disorder. It causes children to age rapidly, starting in their first 2 years of life. Children with progeria generally appear healthy at birth. During the first year, symptoms such as slowed growth, loss of fat tissue, and hair loss begins to appear. Heart problems or strokes are the eventual cause of death in most children with progeria. The average life expectancy for a child with progeria is about 15 years. Some with the condition may die younger, and others may live longer, even to about 20 years. There's no cure for this disease, but new treatments and research show some promise for managing symptoms and complications. What are some of the symptoms? Usually within the first year of life, you'll notice that your children's growth has slowed, but motor development and intelligence are not affected by this disease. Symptoms of this progressive disorder cause a distinctive appearance, which include slowed growth and poor weight gain with below average height or weight, lack of fat that's stored just underneath the skin, head that is large compared with the face, small jaw, chin and mouth, and thin lips, thin curved nose with a slight hook at the end, which may look like a bird's beak, large eyes and eyelids that don't close completely, hair loss including eyelashes and eyebrows, thin, spotty and wrinkled skin, veins easily see through the skin, high-pitched voice, premature aging. Symptoms also include health issues, severe progressive heart and blood vessel disease, or also known as cardiovascular disease. I do have a video of that. I can put that down below for more information on that. Hardening and toughening of skin, delayed tooth formation and tooth shapes that is not usual, some hearing loss, loss of fat under the skin and loss of muscle, problems with the growth and development of the bones, joint problems including stiff joints, a hip that's forced out of the correct position known as hip dislocation, dental problems, no significant progression of puberty, insulin resistance, which means the body doesn't respond well to insulin made by an organ called the pancreas. When to see a doctor. Progeria is usually found in infants or early childhood. This often happens at regular checkups when a baby first shows the distinctive signs of premature aging. If you notice changes in your child that could be symptoms of progeria, or you may have concerns about your children's growth development, make an appointment with your child health provider. Some of the causes: a change in one gene causes progeria. This gene, known as lamin A, LMNA, makes a protein that needed to hold the center of a cell, called the nucleus, together. When the LMNA gene has a change, a flawed lamin A protein called progerin is made. Progerin makes cells unstable and appear to lead the progeria aging process. The changed gene that causes progeria is rarely passed down in families. In most cases, the rare gene change that causes progeria happens by chance. Other similar syndromes. There are other syndromes that may include problems with progein-like proteins. These conditions are called progeroid syndrome. The changed genes that cause these syndromes are passed down in families. They cause rapid aging and a shortened lifespan. The Wiedemann/Raytenstrand syndrome, also known as neonatal progeroid syndrome, starts in the womb with symptoms of aging apparent at birth. The Werner syndrome, also known as adult progerian, begins in the teen years or early adulthood. It causes premature aging and conditions more common in old age, such as cataracts and diabetes. Known risk factors, such as lifestyles or environmental issues, that increases the risk of someone having this or giving birth to a child with this. But the age of the father has been described as a possible risk factor. Disease is extremely rare. If you've had one child with Progeria, the chances of having a second child with this disease are slightly higher than the general population, but are still low. If you have a child with this disease, a genetic counselor can give you information about the risk of having another child with this disease. Some complications: severe hardening of the arteries, known as atherosclerosis. I'll put that on the screen. It's common in Progeria. Arteries are blood vessels that carry nutrients and oxygen from the heart to the rest of the body. Atherosclerosis is a condition in which the walls of the arteries stiffen and thicken. This often limits blood flow. The condition especially affects arteries in the heart and brain. Most children with this disease die of complications related to atherosclerosis, include problems with blood vessels that supply the heart, resulting in heart attacks and congestive heart failure. Problems with blood vessels that supply the brain, resulting in strokes. Other health problems frequently linked with aging, such as an increased cancer risk, usually doesn't develop as part of Progeria. Alright guys, I hope you guys enjoyed. I hope this shed some light if you guys were wondering about this disorder. Let me know down below what kind of disorders or symptoms or whatever you want to see next. Let me know down below. As always, I will put like helpful tips or stuff like that down below as well. Hope you guys are staying safe. I love you guys. I'll see you in the next video. Stay safe.